1, start.
Here with me is a public health officer who is going to give us some of the insights on the effect of COVID-19 on the economy. Welcome.
Thank you very much, Evans, for welcoming me on this show as we discuss the issue of the COVID-19 pandemic and its impact on the Kenyan economy. I'm a public health expert as well as public policy expert, so I'm very much honored to have been welcomed on this show.
So, in your opinion, has the cautionary measures helped to curb the virus, and are the citizens adhering to these measures?
In my view, the issue of COVID-19 is a convoluted idea. It's an issue that calls for much insights. Yes, I can agree that the cautionary measures that the government and the Ministry of Health has taken has really prevented, especially the spread of community infection. It did not prevent per se, but it delayed, and that delay is very important when we have a pandemic such as coronavirus, because when we delay, we give the government an opportunity to provide enough time and even space to deal with the pandemic. I would say they have really helped, like the issue of mask, it has really helped the spread. We have social distance, it has really helped. Washing hands. Hand washing has not only helped to curb the spread of COVID-19, but also it has enhanced hygiene, because people are rarely washing their hands, but because they are washing their hands, it has enhanced hygiene. And even when we talk of masks, nowadays we no longer hear of these opportunistic viral diseases like as common cold. So we say they have hit, the cautionary measures have really helped, yes, in curbing the virus. Though when we come to the issue whether the citizens are adhering to it, as I said, it is a two-way answer. It's not one yes or no. Some citizens who are concerned about their health, especially those living in the high end and those the aging population in the country, which knows that they are very vulnerable, you see them adhering to these measures. And even those literate and living in the high end have taken caution and adhere to this. But when we come to the people living in low-income areas, especially our slums, those people have nothing to lose other than their life, which they have never even taken care of. They are even more than willing to lose their life, because even the kind of life they live, they do not appreciate it. So if you move around the slums, you will realize that issues like handshaking is still going on. They are not even washing hands, because even they do not have access to water to wash hands. They do not have money to buy soap to wash hands, and government has not done enough to provide them with those social amenities. And also when we talk about wearing of masks, it's not taking place. Like the other day I was in Viwandani in Sinai, I realized that it was past 11, but the idea of curfew was not being effected. So it is a two-way traffic question, whether you are living in high end or low end. Yes.
And some of these measures have affected the economy negatively, and the government have also tried to come up with some of the feasible recommendation to help to raise, or rather come up with a good issue on the economy part. So what is your take on the feasible measures that the government has put in place?
Yes, we know any pandemic, be it corona, be it a health pandemic, or be it a social pandemic, or be it even an environmental pandemic, will have a negative bearing on the economy of any state. Regardless of whether the state is weak or strong, it will feel it. Like we have seen even the USA and even the China, some of our hegemony when it comes to economic control and prowess, they have had an impact. And therefore, we can say people have failed corona more than anything else, because they have lost their livelihood, they have lost their jobs all over. And we can say government has come up with some feasible measures to curb it. But in my view, yes, the government has come up with the most feasible measure that the government has come up with is vaccination. but remember, very few people have access to that vaccine. Like in Africa and even Kenya, we only have at least 1% of the population having been vaccinated, and that is the only population that can with certainty claim to have had immunity and having been protected against this virus. But when you come to the larger population of this country, such a measure is yet to have an impact on them. And an area like, in my view, what I thought the government would do, especially to the low-income areas, in the slums and even in our rural areas, the government could have gone further and do an antibody test to determine the spread of this virus, because we do not understand, as far as today, we do not understand the spread of this virus. So if it could have come up with antibody study to determine whether people have ever been exposed to COVID, and after exposure, do they have antibodies to protect them against COVID? And if they have antibodies, how long are these antibodies going to stay in their body? So we need a lot of research around that area so that we can have strong, feasible measures to protect our country against the menace of COVID.
One of the feasible measures we talked about is vaccination.
Yes.
And back then we'd have some issues in the acquiring of vaccines and the PEPs and the rest, cancer, COVID billionaires. What is your take on this?
My take is that I will go back to what Winston Churchill once said, that never waste a good pandemic. So when we talk about COVID billionaires, these are the people who followed the advice of Winston Churchill, never to waste a good pandemic. And therefore they said, this is an opportunity for us to enrich ourselves. And they were reading to the writings of what we call Nassim Taleb. He says, he talks of anti-fragility. What is anti-fragility? Working better in a disorder. So this is, COVID is a disorder, but these people are becoming, enriching themselves. And remember, we are a weak state that cannot even, when it comes with policy measures, implementing those policy measures becomes an issue. That is why you see the rampant corruption. And in my view, corruption is part of our DNA. The only reason as to why we complain of corruption is only because we lack the opportunity to be corrupt. But all of us are corrupt. Even if that, when we have the vaccine, we have seen some private citizens coming up, smuggling into this country some vaccines that had not been approved by KEMSA and KEMRI. That is Sputnik. And they were selling it at an exorbitant prices, just to milk Kenyans, taking advantage of Kenyans who are already suffering, milking them down of their hard-earned cash. So you can see where we are. That is what our core values are. And our core value is corruption. And not unless we change our core values, that problem will not stop. Yes.
So on the vaccination, you've talked about getting some vaccine that have not been approved in the country. So in your opinion, how can you say that the government can help the citizen that the citizen can be ensured that whatever they are being given or whatever they are being vaccinated are approved by KEMSA, are approved by KEMRI, and they are the right vaccination that they should be being administered to?
Remember, the government, which is an agent of the state, has been given the mandate to protect the citizens, their lives and their property. And this government should be seen protecting its territories. Any government that is not in control of its territories, where we see some funny vaccines being smuggled in, then the very government is a danger, becomes an existential threat to the livelihood of its own citizens. So the government must up its game and protect the citizens against some vaccines that have not been approved. so that they do not come in, because the government cannot purport to claim that that it's not aware when these vaccines are being smuggled into the country. And the question is, even if they were not aware, when these vaccines are being administered in the broad daylight, what is the role of the government in this? The government must come in and push these people to book and account.
In this pandemic, we've lost over 3,000, and the vaccination is now over 1 million have been vaccinated. But there's a looming fourth wave of this virus. So, what can you say about some of the measures that the government can take, put in place to curb this fourth wave, and how the citizens should adhere to some of the measures?
As I had said, the government needs to enhance vaccination. You've seen it even in the Western countries. The other day we were just watching this tournament, was it Euro? We have been watching Euro 2020, and you could see those citizens without masks. It therefore means they had been vaccinated. And the question, even if they have been vaccinated, which vaccine have they been vaccinated against? So the government must enhance vaccination so that the larger population, at least 60 to 75%, if vaccinated, we can then say we have attained herd immunity, and we will not be in danger of either a fourth, second, third, or even a 10th wave, because it will not have any impact on us. And as I had said, we need to do more research and come up with a homegrown vaccination, because who knows, maybe when that virus enters into Africa and especially Kenya, it mutates. When it mutates, how sure are we that the vaccination we are getting from the West is suitable for our population? So the government needs to engage some of its health institutions like KEMRI to do more research, and the government needs to fund research in this country and fund it so that it has what it takes to carry clinical research that will come up with the insight and then tell the true story of our Kenyan population, to come up with a vaccine that will then counter the effects of COVID-19.
Thank you very much.
Thank you very much. And more available, in case of anything, you can reach out to me. Thank you very much.
Welcome.
Cut.